So we have Dr. Vikas. He is practicing in Mumbai. So we would be talking about BPH with him. Well, hello sir, welcome. We would like to know why, according to you, the case of BPH is on higher rise these days. What could be the causes?
Thank you first for inviting. See, actually BPH is very common problem.
Yeah.
And as the life expectancy of our population is increasing, we are getting more age group patients between 60 to 80 years, 50 to 80 years. That is the primary reason of increase in prostate. Another is the dietary changes and more coffee, Western diets, cheese, butter and all these things. So dietary changes along with age pool that has increased, that has led to the increase in the incidence of BPH.
Why does it become very important to be diagnosed at a very early age and avoid the delay?
See, basically it is better to get screened for prostate problems because first thing we should rule out any cancerous element in the BPH. Second thing is that there are associated complication of BPH. If we delay it, there are risk of stone formation, risk of recurrent infection, there is a risk of renal failure. So it's better to get it screened on at the earliest basis and get it treated to avoid all these complications.
What could be the complications, to be precise, if a person is not coming at a very early stage and he is being diagnosed at a very late stage? What could be the complications?
So complication could be there is sudden retention of urine.
Okay.
Urine may stop all of a sudden, and we may require emergency catheterization to drain out urine. So that is one thing. Other complications are renal problems, kidney failures, and there are some other secondary complications in form of infection, recurrent infection and stone formation and blood in urine. And some delayed is also pain and renal failure.
Alright, so what do you think when the surgical intervention comes into the play and it becomes necessary and no other choice is there?
So there are some definite indications of prostate surgery. One of that is acute retention of urine, when the urine stops all of a sudden. Second is like recurrent infection because of prostate. So if prostate is disturbing the urine flow, there is a lot of retention of urine, then these patients require operation. Third is the blood in urine, like patient presenting with hematuria. It's third indication. And fourth is like when it affects the kidney function. So when prostate blocks the urine flow such that the kidney swelling increases and patient lands up in the renal failure and obstructive uropathy. So that is the another indication of prostate. So there are some different indications and accordingly patient should go for surgery.
Any lifestyle modifications for the age group of 40 to 50 in order to avoid the BPH in future?
Yeah, see basically we categorize the symptoms according to mild, moderate and severe symptoms.
Okay.
So in case of mild symptoms group, relatively younger age group patients.
How will you get to know that it's a mild symptom?
So we do a scoring of the symptoms. Like there's a AUA scoring is there where we see the frequency, flow of urine, nighttime frequency, intermittency. There are 7 symptoms are there, and accordingly we grade 1 to 5. And then club it to make it a score. So if it is till 7, this is mild score. And relatively younger patient we subject to lifestyle modification, so that surgical side effect is minimal. So lifestyle modification are in the form of dietary changes, like
anything to avoid or not avoid?
Yeah, to avoid spicy and oily foods. And second thing, water intake restriction after 8 o'clock. So we advise in the evening water intake should be low. And avoid beverages like coffee and cokes and all these things. So these are, and smoking, alcohol. So these things are life, and sometimes these mild symptoms patients get improvement with that. So they get improved and they don't require surgery, they don't require medicine also. So definitely some subset of patients are there where it is beneficial.
Any symptom as in how a person can get to know that I might be having a BPH and I should go to the diagnosis?
So first thing in an age group of 50 and above. So this is more common 50 years and above age group patients. So frequency of urine, like going for urine frequently, and strong urgency, like whenever he will have urge of urine, they can't stop the urine. So the urge comes because of prostate, and then flow is compromised when the flow is not good. So these are the early symptoms of prostate.
And he should think of
and then he should consult urologist, where we do urine test, we do digital rectal examination, and we do sonography to assess that how is the
And
prostate
then you can
problem.
help them accordingly.
Yes, accordingly we categorize the patient mild, moderate, and then decide on the medicine, lifestyle changes, and the
Perfect.
surgical.
Thank you so much,
Yeah.
sir, for being
Welcome,
here.
welcome
Very
for
amazing
inviting.
talk.